I went to have a full physical, the phone rang, and he goes, PSA number's very high. Yesterday you told me my prostate was perfect. And he said, I'm not a urologist, which made me think to myself, what the fuck were you doing sticking your finger up my ass for 20 years?
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled Vindog Man Up. This is part of our Perspective series on prostate cancer. Justin, we got a great episode lined up today.
Yeah, I'm real excited to introduce a friend of mine over the last few years who I've got to know and who's just an awesome guy. And he's been sharing his prostate cancer journey through his blogs on Barstool, through his tweets, and his other life experiences and some wonderful stories. We got Vin LeVine, aka Vindog, who's a blogger at Barstool Sports and also a meme lord for Barstool. He is truly a meme god. So, Vin,
I'm a retired meme lord.
Now, I want to thank you, Vin. Thanks so much for coming on. All right, Vin. So before your prostate cancer journey really began, did you ever routinely screen yourself for prostate cancer?
No, I hadn't given it a thought, actually. Up until what happened to me was I had a bad knee, and then I had another bad knee, and we decided one knee was worse than the other, and I was going to have knee surgery. And in order to have knee surgery, I needed a full physical. And then I went to have a full physical, and of course, what's included in it then was a little finger up the butt, check the prostate.
Yep.
And it's not like my doctor hadn't done that for 20 years. And he happened to say to me, just in a cutesy way, like, geez, Vin, for a 65-year-old man, you've got a very smooth, perfectly shaped prostate, right size, everything's good. I was thinking, hey, I'm okay. And we finished up. I took blood. They did the rest of the things. And I went home. And the following day, the phone rang. And I looked down at it. Was the ID said it was my doctor. So I'm like, geez, what's he calling about? You know, I knew it couldn't be good. He wouldn't be calling me back. And I said, hey, what's up? And he goes, listen, I got your blood results back, and your PSA number is very high. And I'm like, what's the PSA number? Prostate. Prostate? Yesterday you told me my prostate was perfect. For a 65-year-old man, it was smooth. It was the right size. Everything was good. And he said, well, I'm not a urologist, which made me think to myself, what the fuck were you doing sticking your finger up my ass for 20 years? You know? Like, really? Why were you doing that? You know? And he goes, well, the blood test is more accurate. I said, well, what's my number? And he's like, 12.8. I'm like, what's it supposed to be?
It's elevated.
He goes, between 1 and 4. And I'm like, uh-oh, am I going to die? And he's like, well, I'm not a urologist. You're going to have to call a urologist right away. And in that moment, my whole world was shattered. I mean, I didn't know what to think. I got off the phone. I was very anxious. And I immediately called my wife at work, and I told her. And I called the urologist that he suggested, and my wife was yelling at me saying, no, you want to go to Dana-Farber, you want to go into Brigham, you don't want to go local, you want to go big-time doctor. Okay, fine. So then we started making appointments, and I'd say the hardest part from there was the waiting.
Now, Vin, I want to hold you off for a second because I think there's some really important points that you've made in this initial journey, right?
No, I'm still getting that reverb, by the way.
Oh, really?
Yeah.
Shit.
I'm just talking through it.
All right. Is that okay? Are you okay
Yeah.
if we just talk through it? All right.
Yeah.
Sorry, dude.
Feel like I'm in a crowd. That's all.
All right. So I think it's really important just to stop there because you bring up several important things, right? So, Kevin and I know the screening age for prostate cancer has actually has lowered in the last about year and a half, 2 years. It used to be around 45, 50. Now it's, if you're high risk, 40, 45 for normal people is what we're starting to recommend. So coming in at 65 and getting your first real PSA, we maybe could have seen signs of this sooner. Now, fortunately, we know the story ends up okay, but there are people who it doesn't end up okay. Now, so it is important that we do get guys getting screened sooner. And just to ask you, Vin, what was the reason why you didn't get screened? Was it because you just didn't know about it, or you just didn't feel obligated? You don't want to go to the doctor?
Well, I did talk to my doctor and I said, how come this is the first time I'm having a PSA test?
Right.
That's a great question. Great
And
question.
he said to me, he goes, well, we used to do them all the time. And we got some like fake results and people were being made nervous and going to the next step. And they didn't have it. We found that it was wasteful. And I said, oh, you mean the insurance company didn't want to pay for it? And he goes, that pretty much was what happened. So we didn't do it for a good period of 10 years. We didn't include a PSA test. That's why you never had one before. We just did the, what do they call that test? There's a name for it. With the finger.
Digital rectal exam.
Yeah. He said, that's all we do. And I'm like, geez, if he had done the test in the blood, I mean, how much more work is that? You're taking blood from me.
Yeah.
You couldn't run it. He goes, we always did. And we got some false positives, I'm sorry. And it was like, then people were really nervous. And then we went to the next step and they had biopsies. And the biopsies came out negative. And we realized that what's normal for one person might not be normal for another. And some people have high PSA numbers and some people have low PSA numbers. And we would jump into conclusion by having the test taken too much.
I mean, that's there. I mean, the U.S. task force pulled the PSA. I think this was like early 2010s or something like that.
Yeah.
So around the timeline matches, and they were pulling it out because they were afraid of over treatment due to elevated PSAs and patients getting care that necessarily may not be seen as beneficial versus the risks that were that they were undergoing. But I think what we've seen now since then, and why it's now PSA is a recommendation in the right age range, right? 45 to about 69, 70 years old, and still share decision-making afterwards to still get this PSA. It's a valuable tool. It's a great screening tool. And, there's a lot of messaging with like the digital rectal exam too, right? A lot of guys don't want to go in to see a doc because they don't want to get a finger up the butt. Vin, did that before you got diagnosed, had that ever crossed your mind where you're like, I don't want to go see a doctor because I don't want to get that exam done?
I wasn't 100% comfortable with it, but it wasn't the worst thing in the world. I figured if I had to do it. Now, I spoke to a friend of mine this afternoon, and he said that the doctors around here aren't doing that anymore.
Yeah.
They stopped doing that. I said, after 20 years of dinging me out, they stop it. I mean, I did. I have to get in there, drop your drawers. You feel pretty horrible about it, And, and I used to say to him, now that you've done that, the first time we did it, do I have to send you flowers tomorrow? What do I got to do here? It's like, all right, this is the first thing as a boy, we all did it. Someone grabs your nuts and tells you to cough. So we do it. And okay, I'm a man now. They're testing my nuts out. And then the next phase after that is the prostate exam. So you figure this is all part of becoming a man. Someone's going to grab your nuts. They're going to make you cough. Then they're going to stick their finger up your ass and tell you about your problem.
Vin,
You're a man.
I gotta say though,
you're used to it.
That's honestly more accepting than most people because to Kevin's point, a lot of guys, there's good data showing that a lot of guys won't go to the doctor because they don't want a finger up their ass. And actually the newest guidelines, and like your friend said, have now said you don't need to do it because you are living proof that having a good exam doesn't mean shit if the PSA is bad. The exam you're only able to feel a small amount of the prostate, although that's commonly where you detect the prostate cancer. But most of the time, if you're able to feel it, it's usually pretty advanced disease. Now, getting a simple blood test is sufficient. And that's important for guys to know, because if they were scared to get a finger in their butt before, now they can go in and just tell their doctors, whether it's their primary care, their urologist, say, hey, listen, I don't want any finger on my butt, but I want to get screened for prostate cancer. Let me just get the blood test.
I'll tell you, I went in, a few weeks ago, and I had like almost a full physical. And I was like, oh, they haven't done a PSA test in a long time. And, my wife is very sick. And I was like, the last thing I thought about was my own health. I was thinking about her, as Justin knows.
Yeah.
And I was wondering, what are they doing? I hope he doesn't do one. I don't want to know anything right now. My nerves can't handle it. And he did it, and it was low enough. I called you right away, though,
Yeah.
to let you know what it was, so that, I'm just assuming that, I don't want to jump too far ahead, but if you get radiation, I think of like a video game where they're just zapping my acorn-sized crust, and what's left of it is like not much. Yeah, I'm thinking
Yeah.
there's not much left after what they did. I ended up getting treatments, and I had 42 of them.
Yeah.
And
Yeah, so look, we're going to get there, Vin. We're going to get there. And I want to get to that process when we talk about
Right.
radiation, because I think that's
Right.
something we haven't talked about on this
No, we
podcast.
haven't.
And so I think your experience is going to be enlightening for our patients. But let's back up. Let's talk about now. So you find out your number, it's, above 12, it's elevated, you're shocked. You're going to go see this urologist at Dana-Farber. So how was that conversation about? And, what did that urologist tell you?
Well, like I said, it took quite a while to get that appointment. And in the meantime, of course, I was totally freaking out.
Yeah.
And I was really, I had one therapist talking to me to kind of walk me off the ledge. And then I had a second therapist. Then I had a third therapist. I had 4 therapists working with me. One could issue drugs. The one was a social worker. The other one worked somewhere else. And then I had my own that jumped in too. And it was like, I was just a total wreck. And my wife had been dealing with ovarian and breast cancer. And she dealt with that a lot better than I was dealing with prostate cancer. And I
But
wouldn't
you
go
didn't know
anywhere.
you had it yet. You didn't even know you had it yet, to be
Well,
fair.
I mean, just the mere mention of the number, like when I asked him what
Oh,
was normal,
100%.
and he told me that number was so high, I just had to assume that this wasn't a good result, So I went in and set the appointment up, and they did some further testing, and they wanted to do a biopsy. Biopsy scared the liver shit out of me. That's more than a finger, man. That's an instrument,
Correct.
And he explained to me what it was, and my doctor slipped out and let me know that, well, they're going to have to puncture through your intestine to get to it. What? I always thought like the prostate was just in there, like you could get right to it. I didn't realize it's on the other side of the intestine wall, and they had to puncture your intestine to get at it. Like, oh, Jesus. I started thinking, because I'm a mechanic. I was thinking about the logistics of what they had to do, and now it scared me. They got to bang a right turn. They got to go in and get the prostate. They're going to nip it. They're going to take, like 12 samples of it out.
Yeah.
But they kept telling me, you won't feel anything. We're going to numb you right up, and everything's going to be good. Like, okay, all right. What am I going to do? I can't say no. So my wife went with me, and we went in. I was very scared. It was a very busy day. And there was one guy, and he did like 20-something exams like that. I couldn't believe it. And I was like number 19 or 20. And I looked at him and said, are you up to do this? I mean, you must be exhausted. And he's like, oh, no, this is what I do all day. This is what I do. This is what I'm good at it. Don't worry about it. I had to lay down on my side, and he stuck something up there. And the first was a little stinger, and then everything got numbed out. And then I was a good patient.
So your experience, it was pretty numb for the most part. So,
and we had a good conversation. We talked the whole time, and he kept telling me, you're gonna hear some noises. You feel a little pinch, but I'm going to get, I think it was 12 samples. He was going all over the place with it. And
so I mean, like, listen, you had a transrectal ultrasound guided biopsy, and that's the standard. But there is another option called transperineal, which is gaining popularity, and it doesn't go through your butt. And
I forgot something, though.
Tell me.
I had to go to an MRI center that did
Yeah.
prostate MRIs first,
Good.
and
Do
that
you
was not
remember
too.
your score?
I forget, but I remember I had to go to one, and I was over in Bridgewater, a couple towns over, and that's all they did. They had the machine that did
Mhm.
prostate MRIs, and that was the first thing I had. And I was hoping that would let them know that I didn't need to go further. It was after that that they set up the biopsy.
Yeah, typically the gold standard, although it's not in our guidelines, really has become the MRI for the prostate um, prior to getting a biopsy. And there's two reasons for that. One, we want to know a couple things, right? We want to get a map of your prostate because what we look at is we can score on a scale of 1 to 5, really realistically 3 to 5 or 2 to 5, the concern of prostate cancer. We cannot diagnose prostate cancer with an MRI, but we can associate risk of prostate cancer. So we look at that and it will help us during the biopsy. If we decide to do one, it could be a good roadmap to make sure we biopsy specifically areas of
And
concern.
that's exactly what they did. I
Yeah.
kind of forget because it's been a few years, but they did take what they got from the MRI. It went over to where the biopsy was being done, and he
Yes.
used that on the screen to go where he wanted to go to get his nippets out.
And there's
Yeah.
good data. One of our good friends, Dr. Michael Adut, who's been on the podcast, actually published this data in New England Journal of Medicine, really showing that it does detect prostate cancer a lot better, these fusion guided biopsies. And the other thing is, you have an elevated PSA, but there's two reasons or multiple reasons why you can have elevated PSA. One can actually be a large prostate. Now, Kevin and I have seen enough men where I've seen guys with a PSA of 12 where you immediately think, oh my goodness, this guy has prostate cancer. You get an MRI and he has a massive prostate. And the prostate, the bigger it is, the more PSA it makes. So it's falsely elevated. And we have a conversation. And sometimes we don't do a biopsy, especially if there's no lesions of concern. So it is an important step. And we're really glad to hear that your urologist did that. But obviously, he saw something concerned. And then you went through with the biopsy, which sounded overall like a pretty okay experience. I don't know, Kevin, what are your thoughts? Any comments on your end, Kev?
No, no. I mean, like, look, it's. I think the elevated PSA, when guys find that out, it does weigh on them. I think it's important. Some of the points you stressed, where it's not necessarily a prostate cancer diagnosis. There is still things. So as long as you kind of keep going and kind of keep doing the digging that we do, there could be other reasons for why it's elevated, and that's important. Um, so I think follow up is very very important. And again, it could be something that you're not that turns out to be a little bit more benign than something more concerning. But
I'll
Vin,
tell
let's
you,
let's
the most difficult part was not knowing.
Yeah.
yeah.
You know, I think once I knew it was prostate cancer, and they kind of said, well, this region here has a low risk. It's not a big deal. We wouldn't do anything if it was all like that. But then they saw one area that was a little bit higher risk. They said, that's the area we have to address.
Yeah.
That's where there might be some fast moving cancer. It's different than the rest. And because of that, that's why we have to go in. And then once they did that, you know, I don't want to jump ahead here too much, but my next appointment was with an oncologist who explained to me the type of cancer I had and the type of treatment plan that they have for me. And it was two different, I think 2 or 3
Well, let's take
different
a
ways.
back step. Let's take a back step because how long did it take to get the diagnosis of prostate cancer? And who told you that diagnosis? And how did you feel at that time?
I think I got a phone call from the doctor that did the biopsy. I think he's the one who called and told me. He was also a doctor who does other procedures, but he did a lot of biopsies. And he's the one who said that to me, that you're gonna have to speak to your oncologist.
Wait, so
And then it
Vin,
was
Vin,
yeah.
let me ask you, in that moment, because I just been through this with my dad and prostate cancer. Like in that moment when he said, like, "Hey, look, we've confirmed it. You've got prostate cancer." Like, what were
Yeah.
you kind of feeling like at that moment?
I'm thinking like this is how it's gonna end. I'm gonna die from prostate cancer, and everybody was telling me that you know, most people don't die from prostate cancer. Something else would get them. A lot of men have prostate cancer when they biopsy men, but they don't. It doesn't go any further. It isn't what kills 'em. And I was like, got a little bit of hope, but I got to be honest with you. I'm glad I had 4 shrinks to talk me down because I was really in a bad way. I mean, I couldn't rest. Everything in my body hurt. One day my stomach hurt. The next day my shoulder hurt. Every day I was going to have X-rays on my back. It was like, and my shrink, one of my shrinks, therapist, sorry, was telling me, my son said I shouldn't use the word shrink. That's from my generation. It's therapist now. So my therapist was telling me that, you know, that when you have psychological stress, it can manifest itself in all your body parts, your back, your stomach, everything starts to hurt, and it's all psychosomatic, and you're really probably fine. I remember I went to have an X-ray done on my back. I was convinced that I had something wrong with my lower back. And the guy said, "Nothing wrong with your lower back." I'm like, "Then why is it so tight?" And my therapist said, you're stressed. When you're stressed, you tighten your stomach, you tighten your back. There was a lot of other things going on because of the stress level was so high. And realistically, at that point, I just wanted to find out how we were going to handle this because not knowing and knowing that there's a different treatment plan, let's get to it. And unfortunately, it takes a long time to get to that final appointment with an oncologist. And actually, we went down to Cape. We were on a vacation in Chatham, and we were having a great time. At least I was trying my best. I was taking Ativan to help me sleep. I was doing a little bit of drinking. I was doing a little bit of gummies. I was trying to numb myself a little bit and just have a good time. I had an okay time, but I was worried. We had an appointment. We went in to Boston right from vacation, and my wife was with me. I couldn't do anything without her. And we told him, "Listen, there's 2 ways to approach this. We can do a full removal." And he told me about the catheter, and they pulled the catheter, and he told me how it happened. And I'm a mechanic, so I can imagine everything that had to be done. They got to disconnect what is it, the urethra?
Your urethra. Yeah.
And it's like, then they're going to reconnect it. I'm going to have a tube in there for 3 or 4 days, and they're going to pull it out. And I was just cringing. I'm like, oh, God, and I know people who had that procedure done. Or he said, we can do, radiation. So I said, okay, because you'll have time to think about this. You don't have to make a decision today. All right. So me and my wife used to go for walks. There was some people in our neighborhood down the street. And one night I went for a walk myself, and him and his wife saw me. "Hey, Vin, how's it going?" So I looked at him and I'm like, "Not real good." "Well, what's wrong?" He said, "Well, I just found out I get prostate cancer, and I got to make a decision whether I have it removed or I have radiation." And then the guy would confess to me, he said, "Listen," he goes, "prostate cancer runs in my family. My father and my uncle both had it. And when my father had it, he had to make a decision whether it was removal, radiation, and he chose to have it removed. And when he was 85 years old, he died of something completely different than prostate cancer. And the one thing he told me was he wished he had had radiation." So when I
Interesting.
heard that, I thought, that carries a lot of weight with it. Here's a guy that lived 85 years, well beyond his prostate diagnosis. And he's saying that he wishes he hadn't had it removed, that he had radiation. So then I made some phone calls. The doctors were telling me that, the thing is, if you have radiation, you can't then have it removed. If you have it removed, there's a chance you may need radiation afterward. So it's up to you. When we look at the numbers are right about even. So we have the same result, whether you have it removed or you have radiation. The result's very similar. There's not a big difference. So my wife and I talked about it, and I said, "You know what? I think I want radiation." And then I had to speak to the radiation people, and they
I
told
want
me,
to stop you there, Vin, because this is a really, really insightful, really important for our listeners, because I think a lot of people struggle with this decision, right? Do you mind me asking, do you remember what your Gleason score was? It was the numbers. It was like 3 plus 4, 4 plus 3. Was it 7, 8, 9 or something? Do you
there
remember?
was I remember like most of the areas were within the range that they wouldn't have done anything. And there was one region that was like, had the higher numbers. I
So it
think
was
it was a
probably like
3.
a 7, probably like, so you're probably in the intermediate risk of some sort. And yeah, in these situations, and this is what, you know, I think one of the beautiful things about prostate cancer specifically is that a lot of times with treatment, a lot of people feel like they lose autonomy over their bodies. They just don't feel like they have control, especially with prostate cancer or any kind of cancer. But the beautiful thing here is you at least have the opportunity to make a decision on your own on the kind of treatment, because it is true. There are certain situations where surgery may be better or radiation may be the better option, but in most situations, they are pretty much equal in their outcomes. And having that ability to choose, I think, is a really wonderful thing for men who are dealing with prostate cancer. Um, and there's a lot of risks and benefits for both things, but I also think the power of hearing experiences, that's why we want to have you on, and that's why we've had other people on perspectives. The power of hearing your experience, and it clearly impacted someone else's experience, clearly impacted your decision, and
Well,
it's so interesting.
Dana Farber gave me numbers, or gave numbers to these 2 guys. The one had his removed, the other had radiation. And we spoke on the phone, and they told me about their experiences. So I had a couple of patients that volunteered to talk to other prostate cancer patients. And, one guy said to me, I had it removed. It was quick. Once they moved the catheter, he goes, I'm back at the gym. We talked about, sex. I mean, obviously that's a concern. And he said, I can have sex. He said, it's not like it used to be, but I can still have sex. And he goes, and I feel really good. And the other guy had radiation, and his went good. So I really had to just weigh it out. And the other guy down the street was really what made me decide radiation. When his father on his deathbed said, because he probably figured at one point his son could have prostate cancer, where him and his brother both had it.
Yeah.
And he just said to him, if I had it to do over again, I would have the radiation. So that's when I said, okay, I'll do radiation. Then it was, time to meet with the people that were doing the radiation, have a meeting with them and talk to them. I think that's when I got my 4th therapist. When I went there, they assigned me to another woman. And I'm like,
Yeah.
okay, I'm getting all the therapists here. I'm talking to all of them. She was good. I like talking to her. And like when I was there, I could talk to her. But they, when I went there, they said, listen, you can either do it in like, I think, a round of 24
Right.
or 28. It was 28, or you can do 42. I said, well, what's the difference? Well, if you do 42, you're less likely to have any bad reaction side effects to it. But most people opt for the 28 because it's, traveling, coming here, and they'd rather get it done quicker. I said, well, I only live like 10 minutes away from this center here, less than 10, and I work from home. So it's easy for me to come in here. I said, I think I'll go for the 42. All right, that's fine. So they set up the 42, and they gave me my instructions. I had to drink 60 ounces of water,
Oh, yeah.
and then make sure I didn't go to the bathroom and get there, and then sit in the waiting room and wait till it's my turn. And, which I did. And on the way, I
Let
had
me
a
ask
bottle.
you though, Vin. Let me ask you, Vin, because my dad dealt with this when he was going through his radiation. Like, did you ever have times where you're like, wow, I drank a ton of fluids, thinking that it's time to go in, and then you really got to pee, and they just didn't get to you in time?
Oh, yeah.
Yeah.
When I first started doing it, they told me that we want your bladder to drop so we have a clear shot.
Yeah.
So we need the water in your bladder to make it drop. So I woke up, I drank, and I drank a bottle on the way over. I sat in the waiting room, and hopefully they took me pretty quick. I get in there, and the girls that did the radiation were great. It was very quick. Because it was the 42, I think I was only in there for like 12, 14 minutes, and I was done. So when I first started, I would go immediately to the bathroom when I get out of there. And I'd take a leak, and then I go home. And then finally I realized, I'm pretty good at this. I don't have to go right away. I'm only 10 minutes away. I can wait till I get home. So I would. I would just leave there, jump in my truck, drive home, go right in the house, go upstairs and take a leak. And it was cold one winter, very cold. And I always used to tell my wife when it's cold, make sure you top off your tank because you don't want moisture getting in your gas. So she had said to me like that morning when she left, make sure you stop at the gas station to top off your tank. So we kind of role reverse. She was telling me. So I drank all the water, had my radiation. I wasn't taking a pee there because I changed my procedure. I was going home first. And on the way home, all of a sudden I'm thinking, wow, I got to stop and I got to top off my tank. I said, I can do that. I can do that. So I took a turn and I went down to one of the Cumberland Farms. It's wide open. It's a wind tunnel. It was the coldest day of the year. It's like 8 degrees with the wind. It was like unbelievable. So I pulled my truck up. I put the gas nozzle in. I start pumping. The cold air's blowing through the wind tunnel under there. And suddenly I got to take a piss. I'm like, you got to be kidding me. So I'm dancing around. I'm thinking I can dance. If I dance, I won't have to go. So I'm dancing around the parking lot. I'm moving. I'm thinking I'm okay. I'm going to make this. I'm looking at the numbers and like, all right. I'm almost there. I got maybe about 8 or 9, maybe $10 more, and I'm in. So I'm sitting there, and all of a sudden, I'm walking, and I realize I got to walk a little further away and then come back. I got to get away. I got to walk. I'm walking pretty good around the parking lot. People are pumping gas and looking, what's this guy doing? He's walking around like nothing, right? So at one point, I decided maybe I should go into the waiting room in the gas station and ask him where the bathroom is. And I'm saying, no, once I hit the warm air and I ask him, I'll piss my pants right in there and look like a fool. So I'm going to keep dancing. So I'm dancing. I'm getting further away from the truck. I'm dancing. All of a sudden, boom, squirt. I'm like, oh, I squirted. So I'm like, okay, it was just a squirt. I'm barely wet. I'm okay. I can do this. And I'm dancing and I'm moving around. And all of a sudden, boom, second squirt. And I'm like, oh, boy. And I'm thinking, maybe I should just kind of end this right now, put the nozzle in and rush home. I'm like, no. It was like this Seinfeld episode when what's his name? It's like, he's trying to run as long as he can on an tank of gas. I'm like, I can make it. I can do this. I wanted to do it. So I'm sitting there, all right, I can do this. And then all of a sudden, I'm getting close. I'm looking at the numbers. They're clicking. They're turning. I'm sitting there. I'm holding. And all of a sudden, boom, another leak. But this ain't a leak, man. This is a total gush. And I just sat there and I pissed my pants. I had my good sweatpants on and went down to my socks. And all I could do was laugh my ass off. There's nothing left to do. And I'm sitting there. I got my gas. I had soaking wet pants. No one saw me. I'm looking around. No one saw me. I jumped in my truck. I had a towel in there. I threw it down on the seat. I drove home the whole way home. And then took a leak, changed my clothes. I called my wife. I said, you wouldn't believe what happened. And I said, it's all because of you. Because you told me to make sure I topped off my tank. And I wrote about it, blog from Barstool. Because you know what? When I first got prostate cancer, my doctor said to me, he says, you ought to write about it. You got a blog, you should write about it. So I started writing about it. And I was real serious about it, and I got so depressed. I'm like, can they give me a 5th therapist? I mean, I was really down. I was ready to jump off a building. I said, I can't do this. I can't write about prostate cancer. Then it was like 3 weeks later. I had like a change of heart. I said, you know what? I can write about this. And I can write about the funny stuff. And I can write the humorous things. And I can talk about what it was like to get get numb and have a biopsy. And talking to the guy, he was a cool guy I talked to. He was down there snipping away at my prostate, and I did it. I did all that stuff. And I wrote the whole, that's when I met Justin, and I met a lot of other people in there too that were either dealing with it, their fathers were dealing with it, their uncles, their coaches, their neighbors. And then you realize it's kind of like one time I wanted to buy a black van for my plumbing business. And the guy says, no, you don't want a black van. I said, why not? Because these black vans get really dirty fast. He said, why do you think there's so many white vans again? Because they get dark, they don't get dirty. Fleet vans are all white. You should buy a white van. And look, he's got all the pants in the parking lot. He wants to sell me a white van. So I said, all right, I got the logic. He goes, wait, once you buy a white van, you go out, you're going to see everybody's driving white vans. He was right. Everybody's driving white vans. And once you have prostate cancer, when you mention it, you realize how many people, how many families, your father, people that deal with it. People get prostate cancer. Not everybody runs down and says, hey, guess what? I got prostate cancer. But if you say something like, yeah, I'm dealing with prostate cancer, me too. I get the same thing. And people start talking, and it did make me feel a lot better when I talk to other people about it. You know, the whole idea of not being afraid to talk about, and talking about what it was like to have a biopsy, what it's like to have radiation, the decision, not knowing, having 4 shrinks. Because when I wrote the blog, when I'm down to I'm down to 3 shrinks, like I'm doing good. When I was down, I've only got 2 shrinks now. I'm down to 2 shrinks. Pretty soon I'll be down to 1. I'll be all right. That's normal, right? So I mean, there was a lot of humor in getting it. Nothing funny about it. But I think that you have to look at the humor side of it. It's I had to deal with it. My wife was much braver than me. She dealt with ovarian. She dealt with, um, breast cancer. And like she said to me, prostate cancer is curable. Ovarian cancer is manageable. And at one point you can't manage it. And I tried not to focus on that. And she was right. She passed away in May. And she was right. But she fought it for 13 years, you know? So I don't know. For prostate, I feel okay. I mean, I don't know. I'm just assuming that, I didn't think about it, but I think when they do radiation, they really take a lot out. Now I prefer video, and some doctors keep blowing it away, and next thing you know, it goes from walnut size down to like an acorn, and now it's a peanut, but you still got it still works to some extent, not as well. No one tells you
Yeah,
that.
I mean, well, I wanna go back to this radiation stuff because I think it's important because a lot of people, when they're assessing these things, they wanna assess the risks and benefits. And obviously, we talked about the benefits are pretty much the same. The goal is to cure your prostate cancer. But when it comes to radiation, a lot of the things that you kind of explained with even the peeing yourself, right? You can get things like overactive bladder, burning with peeing, urinary discomfort in general. You can have urinary frequency. Um, did you and I'm sure they gave you medications like Peridium, maybe Flomax to help you with that journey.
They
Can you
did.
just talk about that radiation and going in every day? When did you start feeling really the side effects of
Well,
of the
they
radiation?
did tell me that I would get some stinging, and they gave me medication for that. It was the one with the P, what you mentioned. And
Peridium.
yeah, I was taking the Peridium, and they said it will make you pee a different color. What the heck was it?
Orange, bright
Orange.
orange,
Orange.
like
Yeah.
radiation
Orange.
orange. Yeah.
So,
Yeah.
I take a pee and I look down. I'm like, all right, it's orange, just like they said it was going to be. And I stopped for a while, and then it started stinging again. I had to call her up, and they were very quick to get me some more of it. And it stung. It stung for a little longer than I wanted it to. But I kept taking the stuff, and eventually it stopped. It stopped. It went away. And I think drinking a lot of water was a good idea. So I drank a lot of water. I just kept drinking a lot of water and flushing myself out, and but they did tell me about all the risks, and they said that because I went with 42, there was less likely that there would be damage to my bladder. And to me it seemed like they put the map in the machine, and the machine knew exactly where to perform the radiation, so that it didn't go near places. I felt confident. I had to feel confident that
Well, yeah.
this machine. You
Let's
walk
talk
in, you
about
take
that.
a look at the machine, and it's like, oh my God, this thing is $1 million machine, and it's probably
More than
really
a
good at
million
what it
dollars,
does.
brother.
How much is it?
couple
More than
million,
that.
couple million.
Couple million. I'm looking at that machine. They had a name for it at my center. They called it something. I forget what the girls called it, but they were good at what they did too. I mean, they made sure that all the markers, because that's the other thing we didn't talk about. They put the markers on, so the machine will find the markers. So my wife had markers too when she had radiation, and little green dots. And I knew, okay, this is going to like a laser. It's going to find the spot. The machine's going to set up based on these markers, and it's going to do it every single time. And if it's as good as everybody says it is, I didn't feel the risk of burning through my bladder or having any other issues. And I felt
Yeah,
that going with the 42 was a good move for me.
Yeah, let's recap actually that radiation stuff. So there's a lot of different lengths and treatment that you can have. It's something that you kind of talk with the patient about, but the shorter the treatments are, you get a little bit more radiation, a little bit at that time. The longer out the treatments, the lower the radiation. And the technology has come, and it's so fantastic now when they really target and map out your body. And they're asking you to fill up your bladder to really drop that prostate real nice into that target zone. It's pretty precise now that, a lot of stuff that we were dealing with maybe about 15, 20 years ago, where you were getting a little bit more radiation that was impacting the bladder aspect of it, that can lead to bleeding and some of the more, not so great side effects down the line. They've really fine tuned it. So it's pretty good these days. The technology is just a wonderful thing. Vin, I want to kind of transition a little bit though, because I wanted you to kind of talk to us, like, in addition to radiation treatment, did you have to take, like, was there any other medications
Oh, I
such as
did.
like
Yeah.
hormonal therapy medications suppression medications that
Yeah.
they wanted you to be on?
I almost forgot about that. Thanks for reminding me. They gave me medication to take. They gave me a shot in my butt and lasted for like
Lupron?
2 months.
Lupron?
Yeah. Yep. And they told me it's kind of like having a chemical castration,
Yeah.
but it's temporary. And I thought, oh, I hope it is. I hope it is. I don't want to find out that mine took, but they said you're going to lose muscle tone. They said your voice might get a little higher. I said, am I going to start watching Hallmark movies with my wife? You could. You could. And, I started taking it. And what am I going to do? It's like, okay, he told me, he said, listen, it's going to be helpful for you. We have found that by taking this along with radiation, it increases the potency and we have much bigger success rate. So I'm like, okay, well, what am I going to do? I mean, you're looking at, healing or death. I don't want to die. They tell me to take this. So I got to run around with a high voice. I'll do it. I lose muscle tone. I'm okay. I don't care. I'm not lifting weights anymore. I'm like, okay, I can do this. And I did it. And then when I finally went in afterwards I remember talking to you, Justin, and they did a testosterone number. The number was high. And he said to me, he goes, sometimes we keep people on doses of this. We're not going to do it with you. He said the rewards, benefits. He says, we're not going to gain much from it, like 1 or 2%, not worth it. So he took me off of it right away. I was kind of happy about that. But if you told me to stay on it, I would have stayed on it.
How long were you on it for?
I think I was on it at least, I think 6 months to a year. I think I had, how long does the dose last? Because I had
So about 3 months. Each injection is
so
about 3 months.
I had 2 injections, so it was 6 months.
Okay.
I was on it for 6. And then when I went back in there, they saw the number of testosterone. Then they said to me, we don't think you need to take it. I said, all right.
So
Yeah.
how we describe what we call that is ADT, androgen deprivation therapy. And the idea is that when you have prostate cancer, it may feed off of the testosterone in your body. That doesn't mean that testosterone, and Kevin and I have talked about this at length, taking testosterone does not cause prostate cancer. However, in this situation, when you're radiating your prostate, how we use as an analogy is, if you're a boxing, the ADT, the Lupron injection is kind of like these little jab hits to the prostate cancer. And then, so it's weakening your defense system so that when you get the radiation, it gives it that knockout punch to really.
I think what they did with me is they first gave me the injection, and then we waited a certain length of time, and then I went in and I had my PSA number taken again, and I think it had gone down quite a bit just from the injection.
Yes.
Then I had the radiation, and then I had a second injection, And then after the second injection, the radiation completed. And then they took the test and said, my oncologist said, we don't feel there's much of a benefit right now to stay on the Lupron. So you're okay. And I was like, oh, I was happy he said that because I thought he was going to make me. My neighbor had prostate cancer also before me, and he had it removed, but then he needed radiation, and they put him on Lupron, and I believe he's still on it.
Yeah.
It's funny, he's still on it, but like, he doesn't have a squeaky voice. He didn't lose his muscle tone. So I don't know whether you
Everyone
get,
responds very differently to it, truthfully. I mean, some people you would never know are on it. Some people it can
because you're
impact
not
them
supposed to drink
significantly.
when you take it, right?
I don't think that's the case. I think that there are concerns of, one risk of being on this medication is bone fractures, frail bones. So maybe if you're getting hammered drunk and you
Yeah,
fall,
getting
probably
thrown
you're
out
at
on the
higher risk.
sidewalk at a bar, yeah.
Right, right. Then you're at higher risk. So I would say you probably shouldn't get hammered drunk where you're going to fall to the ground and hurt yourself. But yeah, some people, that's why in the beginning we asked about the staging of your disease, because some people, unfortunately, if they have disease that's spread outside of their prostate, oftentimes, fortunately, you didn't have that issue. They may be on the Lupron or other similar medications for the rest of their lives, unfortunately, and that can
Now when
have
I spoke to
lingering effects.
those guys that were like helping me out from Dana, and I told him about the Lupron, he said he never took it. I
It
said,
really
well,
depends. It's very individual. It's pretty amazing that based off of your prostate cancer diagnosis, the grading, um, we have a very catered, algorithm to specific things. Not everyone who gets radiation actually needs the Lupron anymore. Some people need to be on it longer, though. Some people can be on it on an interim basis
see at
or a
Dana, they
shorter
told me
interval.
that was it had become procedure there. That anybody
For
having any type
yours,
of
it might be, right? Like, and like, once again, I can't talk to the radiation oncology team at Dana, but I am sure they are a top facility. They're Dana-Farber, obviously, so they know what they're doing.
now
But
I
there
was at
is
I was at a party one winter, and there was a guy there who was much older than me. He was in his mid to late 70s, and he had prostate cancer. And he said, "Oh," he goes, "don't do the radiation. Do this with something knife. I forget what it's called. Maybe you're familiar with it. It's another."
CyberKnife.
Yeah, he said I only did it. He goes, I had one or two or three treatments, and that was it. And my cancer's gone. He said, you should do that. And I asked Dana about it. And they said, yeah, there's people doing that, but we don't have enough data on it to support it. So we're not doing it. So I don't know if that's since then has become something that people have looked more into. Because he was mad at me. This guy we were friends, and he was mad at me. He's like, don't do the radiation, do this. Don't put yourself through radiation. Because he was probably under the impression that it was not as accurate now as it was 15 years ago. So he said I wasn't going through 30, 40 treatments when I could do the knife thing and just get myself 2 or 3 and I'm done.
I mean, there's a ton of technologies now trying to do more precise and less invasive treatment options for prostate cancer. You have like proton beam therapy, HIFU. Some people are looking at cryoablation again, and so there's a lot more minimally, like, lesser treatments, lesser side effects. But at the end of the day, the way I explain to patients is like, look, the gold standard still, when you're, with the most evidence behind it, is radiation and surgery. These other ones can be an option in the right nuanced patients, generally when it's like a little bit lower risk and we have a little bit more leeway to still, kind of monitor. But I mean, still to this day, and then the cyber knife, I think, I actually don't know too much about that, but that's, I still see patients actually that have had that procedure done.
The
Yeah.
guy who had cyber knife, he's still alive and well.
Yeah.
He hasn't needed more treatment.
So, I mean, listen, and this is an important point too, right? I think everyone has their biases, right? You have a great experience, you're going to recommend that procedure
Yeah.
to everyone. You have a bad experience, you're not going to recommend it. The truth is somewhere in the middle, right? Because, I don't blame these people for feeling a certain way, but there's also um, an in between area where we don't know what kind of cancer they had, how aggressive it was, the location. So, even though it was the right option for that person, it may not have been an option for you. And it sounds like it probably wasn't an option for you, truthfully.
Yeah,
But
because
like, it's hard to know. And you did the right thing. You went to your doctor and you said, "Hey, I heard about this. Is this a good option for me?" And they gave you an answer that seemed to have been satisfactory for you.
it's kind of like, my wife was so positive about Dana Farber, and like as soon as Dana Farber said, "No, we don't have enough data to support that," we gave you a couple treatment plans based on what you have. And I at that point, it's like, the words when you grew up around Boston, Dana Farber means a lot.
Yeah.
Everybody's always talking about Dana Farber. And it's like, if they say something, it's like, go with Dana. And that's what I ended up telling that guy. You know what? I'm not going against, what Dana Farber is telling me that I should do. If they say they don't have enough data on that other stuff, I'm doing what they have data on and what they have proven will work. And my wife
So
felt the same way. Do
I
what your oncologist at Dana says. You got
Yeah,
a
man.
choice. You make your choice. Let's do it. You know.
I think it's really well said. And so, you go through you go through the Lupron injections, you go through the radiation. Um, how was the recovery process after all of this? Once it's done, when did you start feeling like Vindog again?
Well, when I was done with the radiation, you ring the bell, and they got a little video of that.
How'd that feel?
That felt pretty good. Like I saw other people ring the bell, and I wanted to ring the bell. I mean, that was like, yeah, I want to get to that
You
point where
gotta
I'm
ring
ringing
the
the bell.
bell. You gotta ring
Yeah,
the bell.
I'm definitely want to ring that bell. You know, and it felt good to ring the bell because I knew I had went
Yeah.
through the treatment. But it's not over just because you ring the bell. You got to
Right.
go in and get yourself tested to make sure your PSA number. And right afterwards, he told me it's going to be wicked low because you just had all your radiation. He goes, if it jumps up, don't get nervous because sometimes it'll spike and then come back down again. So it never really did. But I that whole thing. I don't like going to the doctors. You guys are doctors. I'm sure if you have to go to the
I don't
doctors,
like
you
going to
get
the doctor.
yeah.
I'm a doctor myself.
Yeah, I don't like it. I go to the
Yeah.
doctors. It's like, all right, you're gonna put the car up on the lift. You're gonna find something. It's
Yeah.
like there's something you're gonna find something. There's something wrong. I'm 69 years old now. I mean, geez, something's wrong with me. I know it.
Yeah.
So like right now, I'm battling, high blood pressure,
Yeah.
and I'm battling AFib. And they got me on all kinds of meds. And I'm like, oh my god. It's amazing because I was at the doctor's office, and he's giving me like metropitol, and he's Losartan and other blood pressure meds. So I'm checking out to set up my next appointment, and the woman who's checking me out is from Barbados. She goes, "Oh, I see you in your chart here." And, she's privy to looking at my chart, which
Yeah.
she's not qualified to look at the chart, but she can see it. And she goes, "I see here you got high blood pressure." I'm like, "Yeah, I do." She goes, "You look kind of chill." She goes, "You don't look like a person with high blood pressure." I said, "Well, I don't feel like I have it, but apparently I do." And she says, "What are they're doing? Oh, they're giving you this and that." She goes, "You know what we do in Barbados?" I'm like, "No, what do you do?" She goes, "Oh, we eat beets. We take magnesium, uh, CoQ10." And she started saying, "We take baths and Epsom salt for inflammation. You ought to start doing some of that stuff." I said, "Really?" So now I'm thinking, wow, this woman at the checkout is interesting, from Barbados. She knows stuff that they're not telling me in there about high blood pressure. So I went home. I got some magnesium. I got some CoQ10 with some beets. And I did speak to my doctor. I said, "Say, what do you think of magnesium?" And I thought he was going to yell at me, like, "Oh, you don't do that." And he goes, "Oh," he goes, "they've done a lot of testing, and it's been proven that magnesium does help lower blood pressure. I haven't got a problem taking that. I says, what about the beet formula with the CoQ10? I don't see a problem with that. So I'm doing all stuff. And my blood pressure went down a little bit the last time. So
Excellent.
now, it's kind of like, you go to different doctors and they kind of contradict each other a little bit.
For
I
sure.
went to a cardiologist. He said, well, he goes, you have AFib, it can originate with high blood pressure. Because I'm surprised no one ever addressed your high blood pressure because it was a little bit on the high side. I said, no one ever told me that it was something that had to be addressed. So I'm hoping that maybe now that we are addressing the blood pressure, and the thing that's really scary now is they get me on all these meds, so I feel like a lab rat. They give him different meds to
That's
try.
that's actually that's one of the big things that Justin and I always deal with because we see the med rec lists as it's like you get a med added on and it's just gonna stay on forever, and then we're just gonna keep stacking it. And dude, taking these meds, over and over, like it's cumbersome and it can be difficult. Vin, I want to actually go back to something actually I think really important. You've this theme of community, right? You're ringing the bell when you finish the radiation. Everyone else in the room clapping. Everyone, there's a sense of community that you're going through it. You're writing a blog, about your prostate cancer. So many people out there who are also going through from it benefit from it, right? This sense of community and having people to talk to. I think it's so much power in that, especially in people going through cancer treatments. Now, I think this question I'm going to ask you now, because we've been talking about it. You've had the friend that said the cyberknife was awesome. They would do it. The other friend who said, like, I would never have gotten a prostatectomy. I get radiation. I'm going to ask you, and disclaimer, this is anecdotal from you, but would you recommend radiation treatment to other men diagnosed with prostate cancer?
Honestly, I definitely would, because, the thing is, like, the only thing I can say is, like, you don't feel anything when you go in there. You don't feel anything when you walk out the door, but you do know that there's a lot of stuff going on inside, but I think it was easier for me mentally, physically, to go in, lay down on the table. The girls that were doing it were incredible. I mean, I love going there and seeing the same people every week. They were friendly to me every day, actually. I didn't miss a day. I went 42 days straight, didn't go on weekends. And I think something happened. It was a holiday, but they squeezed me in somehow. I didn't miss anything, because people miss. You get weather. There's a lot of reasons why you can miss. I didn't miss anything. I did it. I rang the bell, and I had a good result afterwards. So I would definitely recommend it. And again, the reason why I did it really is because the guy down the street told me about his father. And once I heard that, why would a guy on his deathbed not tell his son that if he didn't feel that that would have been a better way for him to go? So once I heard that, it just made me think that, because at first I thought maybe I'm copping out having radiation and not having it removed, because real men have it removed, and I just didn't want to do that. And I think I went with the radiation, but I didn't realize then that, how serious radiation is. I mean, it is also very serious stuff.
Yeah.
Just because you can't see it and you can't feel it doesn't mean it ain't serious. In fact, that probably means it is serious because you're doing something
Yeah,
you don't know what's happening. So it's pretty serious stuff. But I'm happy right now with my choice. If I don't know what the future holds, I go to the doctors and they do blood and they take care of me. And I think the medical profession makes a lot of money with people between 57 and 75 years old. We all need something, and all my friends were all the same way. We were always nervous about going to the doctors. You drive over there and they take your blood pressure, and of course your blood pressure is going to be high. You get nervous on the way over. You get there. By the time you get there, you're wound up. Then they take it again after you've been there for a while and you're settled in. It's always lower, you know. Um, but I would recommend the radiation. I would.
Now, is there one thing though for people who are either interested in getting radiation or about to get radiation that you think you didn't know or expect that you would tell them?
Well, I would think that, I didn't really give it a whole lot of thought that radiation is knocking out a good portion of your prostate. Like whatever you got for the walnut, when
Yeah.
they start to radiate it, it gets smaller because they're
Yeah.
knocking out parts of it, and they always do what's smart is they go a little bit bigger than where they think the cancer is. So in case it's spread it a little bit beyond, they get in the area beyond. Because that's what he told me. Don't worry.
Yeah.
When we give you radiation, it's going to take care of your whole prostate. So if there's anything else there, it's going to be gone too. So I don't know what percentage of my prostate is left. You know, I
More
don't
than if
know
you had it taken out, though, I'll tell you
what's
that.
that. When have someone put their finger up there to see what's left.
Well, people do, right? But I mean, that's part of it. And you said, great news, your PSA is low. And I think it's important for patients to understand that your PSA, while not a good marker, it's our best marker we have realistically for screening for prostate cancer. But once you have a diagnosis of prostate cancer, it actually becomes a really important marker in terms of our treatment, right? Because if you have your prostate taken out, you no longer have a prostate, which means your PSA should be 0. Now, if you have radiation, however, it's a little bit different. Some people's PSA goes to 0, but not everyone's PSA. And you do have to trend the low point and what we call the nadir. And you do have to track PSA, whether you have your prostate taken out or not. But, it's okay and it's acceptable after radiation. It's understood your PSA will go a little bit higher, but there is a threshold that we have. So, it can be worrisome, but this is something that's important to understand, that you're not done after your treatments. You have to go up, you have to follow up with your urologist or your radiation oncologist for these things, right, Vin?
I know. It's my neighbor, like, he had his removed. So I said, "Hey, how's everything going with your prostate?" And he's like, "Well, I'm still, 0 because he's got nothing there." But he
Right.
did have a problem right after he had it removed, and he needed radiation. And then he went on the
Mm,
Lupron, and he's still
yeah.
on. It's been like 20 years he's been on Lupron. So the Lupron must make sure that nothing grows back.
Yeah.
Um,
Yeah.
so he's at 0, but like with me, like you said, I have enough prostate left that I will have some PSA level.
Right.
And I wonder, I mean, I don't know. I get nervous even talking about it, like what percentage of my prostate's left and what would be a high number for limited prostate material left. Yeah, I don't know, you know.
The rule is usually 2 plus the lowest number is when we start getting concerned of recurrence of disease of prostate cancer in men who were treated with radiation. So if you, for example, your last number was your lowest number was 1.2, it would have to be 3.2 for us to start really worrying
Worrying about it.
about it coming back, right? If it was 0.5, 2.5 is when we would start worrying about it coming back. And obviously, there's a lot of debate. Do you wait if you see it trending up? What do we do? And there's nuances to all of these things, but that's the general rule that we have learned as urologists. But yeah, listen, I think what you said is important, right? You're still going back to the doctor to check your PSA. You had your testosterone, which has recovered amazingly. I mean, he's biking every day. You're biking all the time. We talk. And so I think, it's really amazing that you shared your story with us today. You shared your story on the blogs. You're out there talking about these things that are not easy. And obviously there's other experiences, losing your wife that you've been really open about and sharing as well. And, I think we're so lucky. I think Barstool is lucky to have you to share these experiences and to normalize these kinds of conversations that most guys are scared to talk about. And not only do you talk about it, you talk about it really well and really interesting and engaging. And, I have always appreciated
Hey, we had merch.
that. We did. I bought the merch.
Yeah, we had hats and T-shirts and stickers. At one point, I bought like 50 stickers, and I was giving them out to people. The nurses down at the radiation center all put them on their cars.
That's
You know,
awesome.
they loved it. My local sub shop had one in his window.
Yeah, man.
Um,
So I think that's about it, man. Kev, you any other questions on your comments on your end?
No, Vin, I mean, again, thank you so much for coming on. I think, your experience, the way that you put it, the humor that you put on it, it's such a great way of looking at it and sharing that story. And there's so much power in that. So I just want to thank you for coming on and loved it, man. Absolutely loved
yeah,
it.
there was like a blog series I did. I did like 3 or 4 blogs on it, and I updated people on my progress, and I showed the picture of ringing the bell, and, it was the whole process. I decided once I started doing it, and I said, "Just talk about peeing your pants." People were sending me messages, like, on Twitter, like, "Man, I'm sorry, man, but I laughed my ass off. I almost pissed my own pants." You know? It's like, well, that's what happened. Like, my wife told me, to make sure I topped off my gas tank. Um,
Awesome.
but, yeah, I don't know. I don't know what to expect. You get old, your machine breaks down a little bit. No one gets out of here alive. I don't know how it's gonna end for me, but, I don't want it to end anytime soon, and I hope it ain't the prostate that takes me
It's
down.
not gonna be the prostate, and you're gonna keep kicking ass, man. So tell our listeners, who I'm sure they all know you, but where can they find you on Twitter? What's your Twitter
At
account?
Vindog56.
Vindog56, and then follow him on Barstool. Check out all his blogs. They're really wonderful. All of them are wonderful. Very different style. He's a storyteller, and a really wonderful one at that. So thanks again to all of our listeners as always. Download, subscribe, give us a review, 5 stars. And for Kevin and I, thanks for listening.